Have you reviewed the Medicare Physician Fee Schedule, or PFS? Are you aware it has been released and there is guidance on telehealth, Medicare opioid coverage, and payments for substance use disorders? If not, this video will provide you with all the information you need. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. The Medicare Physician Fee Schedule for calendar year 2020 was released on November 1st. And if you are involved with coding physician services, there are some nuggets for you. In this video, we will focus on the guidance related to telehealth, Medicare opioid coverage, and substance use disorders. Let's start with telehealth. If you have a suggestion for telehealth service codes, CMS intends to accept requests through February 10th. For example, to be considered during the PFS rulemaking for calendar year 2021, requests to add services to the list of Medicare telehealth services must be submitted and received by February 10th, 2020. Each request to add a service to the list of Medicare telehealth services must include any supporting documentation the requester wishes to have considered as CMS reviews the request. Requesters should be advised that any information submitted as part of a request is subject to public disclosure for this purpose, since the annual PFS rulemaking process is the vehicle to make changes to the list of Medicare telehealth services. CMS is adding 3 new HCPCS G codes to describe new bundled services for treatment of opioid use disorders. They are HCPCS code G2086, office-based treatment for opioid use disorder, including development of the treatment plan, care coordination, individual therapy and group therapy, and counseling, at least 70 minutes in the first calendar month. HCPCS code G2087 is office-based treatment for opioid use disorder, including care coordination, individual therapy and group therapy, and counseling, at least 60 minutes in a subsequent calendar month. And HCPCS code G2088, office-based treatment for opioid use disorder, including care coordination, individual therapy, and group therapy and counseling. Each additional 30 minutes beyond the first 120 minutes. And you would list this separately in addition to code for primary procedure. Since some components of the HCPCS codes G2086 through G2088 describe care coordination that are commonly furnished remotely using telecommunications technology and do not require the patient to be present in person with the practitioner when they are furnished, then they are being added to the telehealth services list. Next, let's talk about Medicare coverage for opioid use disorder treatment services furnished by opioid treatment programs, or OTPs. I am sure you're aware that opioid use disorder, or OUD, and deaths from prescription and illegal opioid overdoses have reached alarming levels. The Centers for Disease Control and Prevention, or CDC, estimated 47,000 overdose deaths were from opioids in 2017, and 36% of those deaths were from prescription opioids. OUD has become a public health crisis, and on October 26, 2017, Acting Health and Human Services Secretary Eric Hargan declared a nationwide public health emergency on the opioid crisis. This public health emergency has been renewed several times, and most recently, October 16, 2019. The Medicare population, including individuals who are eligible for both Medicare and Medicaid, has the fastest growing prevalence of OUD compared to the general adult population, with more than 300,000 beneficiaries diagnosed with OUD in 2014. An effective treatment for OUD is known as medication assisted treatment, or MAT. The Substance Abuse and Mental Health Services Administration, or SAMHSA, defines MET as the use of medication in combination with behavioral health services to provide an individualized approach to the treatment of substance use disorder, including OUD. Currently, Medicare covers medications for MET, including buprenorphine naloxone combination products, and extended release injectable naltrexone under Part B or Part D, but does not cover methadone. Medicare also covers counseling and behavioral therapy services that are reasonable and necessary and furnished by practitioners that can bill and receive payment under Medicare. Historically, Medicare has not covered methadone for MET because of the unique manner in which the drug is dispensed and administered. Medicare Part B covers physician-administered drugs used in conjunction with durable medical equipment and certain other statutorily specified drugs. Medicare Part D covers drugs that are dispensed upon a prescription by a pharmacy. Methadone for MET is not a drug administered by a physician under the incident to benefit like other MET drugs, and therefore has not previously been covered by Medicare Part B. Methadone for MET is also not a drug dispensed by a pharmacy like certain other MET drugs, and therefore is not covered under Medicare Part D. Methadone for MET is a Schedule II controlled substance that is highly regulated because it has a high potential for abuse, which may lead to severe psychological or physical dependence. As a result, methadone for MET can only be dispensed and administered by an opioid treatment program, or OTP. Additionally, OTPs, which are healthcare entities that focus on providing MET for people diagnosed with opioid use disorders, were not previously entities that could bill and receive payment from Medicare for the services they furnish. Therefore, there has been historically a gap in Medicare coverage of MATs for opioid use disorder since methadone has not been covered. Section 2005 of the Substance Use Disorder Prevention that promotes opioid recovery and treatment for patients and communities Acts, or the Support Act, added a new section, 1861(3), to the Act, establishing a new Part B benefit category for OUD treatment services furnished by an OTP, beginning on or after January 1st, 2020. The Support Act amended Section 1861 of the Act by adding a new subsection that defines opioid use disorder treatment services as the items and services that are furnished by an OTP for the treatment of OUD, which include opioid agonists and antagonist treatment medications, including oral, injected, or implanted versions that are approved by the Food and Drug Administration, or FDA, for use in the treatment of OUDs. Dispensing and administration of such medications, if applicable, substance use counseling by a professional to the extent authorized under state law to furnish such services, individual and group therapy with a physician or psychologist or other mental health professional to the extent authorized under state law, toxicology testing, and other items and services that the Secretary determines are appropriate, but does not include meals or transportation. And lastly, bundle payments under the PFS for substance use disorders. CMS will allow bundle payments for the overall treatment of OUD, including management, care coordination, psychotherapy, and counseling activities. If a patient's treatment involves MAT, this bundled payment would not include payment for the medication itself. Billing and payment for medications under Medicare Part B or Part D would remain unchanged. Additionally, payment for medically necessary toxicology testing would not be included in the proposed OUD bundle and would continue to be billed separately under the clinical lab fee schedule. Use of these codes is limited to only beneficiaries diagnosed with OUD. However, CMS may consider other potential bundles describing services for other substance use disorders in future rulemaking. There are two HCPCS G codes to describe monthly bundles of services that include overall management, care coordination, individual and group psychotherapy, and counseling for office-based OUD treatment. These services would often be billed by addiction specialty practitioners, but these codes are not limited to any particular physician or non-physician practitioner specialty. The codes and descriptors for the services are HCFS code G2086, office-based treatment for opioid use disorder, including development of the treatment plan, care coordination, individual therapy and group therapy and counseling at least 70 minutes in the first calendar month. HCFS code G2087, office-based treatment for opioid use disorder, including care coordination, individual therapy and group therapy and counseling at least 60 minutes in a subsequent calendar month. And HCFS code G2088, office-based treatment for opioid use disorder, including care coordination, individual therapy and group therapy and counseling, each additional 30 minutes beyond the first 120 minutes, and you would list this separately in addition to the code for the primary procedure. Keep in mind, practitioners reporting the opioid use bundle must furnish a separately reportable initiating visit associated with the onset of the OUD treatment, since the bundle requires a level of care coordination that cannot be effective without appropriate evaluations of the patient's needs. Remember, all the rules and codes are valid beginning January 1st, 2020. Next week, we will discuss what's happening in the world of evaluation and management services, physician assistance supervision, and codes for online digital assessments. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos. And check this out.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
Feel free to subscribe to our channel and click the bell for notifications when we upload new content. I love hearing from you, so let me know you were here by providing a comment. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.